In terms of neurologic symptoms are truly reflective of the location of the brain that is affected. With regard to primary CNS lymphoma, what we do know is that the more common symptoms that patients do present with are symptoms suggestive of confusion or cognitive deficits or memory disorders. And these are quite interesting because the majority of patients with primary CNS lymphoma are people that are over than 65 years of age. And so sometimes what can happen is that patients can be thought to have memory disorders or cognitive disorders or even Alzheimer's. What is the key part for primary care physicians to pay attention to is the timeline of these symptoms and the trajectory. Because typically with primary CNS lymphoma, these symptoms will progress a bit rapidly over a matter of weeks rather than something that is insidious that is going on for months or years, which is the typical course with memory disorders. Other than that, focal deficits, as you mentioned, are very classic and symptomatic. And then some patients do present with signs and symptoms of raised intracranial pressure, which includes headaches, but also visual obscurations or symptoms where patients have trouble with their vision. And then finally, I do want to mention seizures. Now, seizures are a common symptom with most brain tumors. However, this is not the most typical presentation for primary CNS lymphoma. And in fact, in most studies, seizures are seen in less than 15% of patients, as opposed to with other primary brain tumors or even brain metastases where they're seen in 80% of patients, or so on and so forth. So seizures are not super common in primary CNS lymphoma, but confusion, memory disorders, walking abnormalities are things to look out for, occurring over a period of a few weeks.